Without wasting even a single more minute, we are going to discuss another wonderful class, that is Nutrition and Public Health Part 4, and it's Understanding Mineral Deficiency Disorders. And this lecture series is part 4 of our lectures on nutrition and public health. We have already delivered 3 lectures prior to this final lecture of our lecture series. We covered vitamin deficiency disorders in previous class, and prior to that class we covered carbohydrates, proteins and lipids, and prior to that class, in our first class, we discussed the basics of nutrition. So first we discussed basics of nutrition in our part 1. Then we discussed the concepts of malnutrition, and then we discussed the concept of vitamin deficiencies. And now today we are going to discuss mineral deficiency disorders. So basically, if I wanted to go into further details, I could go into details a lot further, but then it would have complicated the topic too much. And we are not teaching the doctors here, so I couldn't add too much of the medical things. I couldn't add too much of the clinical aspect here. But yeah, I try to touch each and every important thing here. So today's topic is Nutrition and Public Health Part 4, Understanding Mineral Deficiency Disorders. Most of the students already know about me, who I am, what do I do for a living. So learning objectives for today's class are very simple. It's introduction, brief summary of previous class, then basic definitions, major minerals and their deficiency disorders. Then there are trace minerals and their deficiency disorders, and how to overcome vitamin and mineral deficiencies in general public. I haven't added any slide about how to overcome vitamin and mineral deficiencies in general public, but yeah, we will discuss it thoroughly, and most of the question answer session will be part of this discussion, how to overcome vitamin and mineral deficiencies in general public. So introduction, as discussed in previous classes, we are what we eat. Whatever our health condition is, it's just because of our diet. If we are taking a good diet, we are living a very healthy life. And if we are not taking a good diet, we are not taking a healthy life. At the most basic level, the concept of having a good nutrition means eating a regular, balanced diet, as nutrition is the thing which keeps our body systems running optimally all day long. The foods we eat supply our body with the needed nutrients to maintain our brain, muscles, bones, nerves, skin, blood circulation, and all the organ systems and immune system. Proper nutrition also helps us protect from illnesses and many diet-related diseases. So brief summary of previous class. In previous class, we developed an understanding of vitamins and their metabolism, fat-soluble vitamins and their deficiency disorders, and their treatment was discussed. Water-soluble vitamins, their deficiency disorders, and treatments were discussed. Vitamin B complex and vitamin C were discussed in detail. So important definitions. We already know all of these definitions, so I will skip this part. Then major minerals and trace minerals. So this section will elaborate the topic of minerals, major minerals and trace minerals, including their deficiencies and the effects of deficiencies. Minerals. Minerals are those chemical elements on the earth and in food that our bodies need to develop and function normally. In the context of nutrition, a mineral is an inorganic chemical elements. Some minerals are essentials for life, others are don't. Depending upon the daily requirements of our body, minerals are divided into major and trace minerals. So basically, minerals are part of the Earth's crust. They are normally, naturally present in the soil, the stones, the Earth's surface. So basically, just like calcium, phosphorus, sulfur, all of these minerals are present in Earth's crust. And depending upon the daily requirements of our body, minerals are divided into major and trace minerals. Yes, our body needs some minerals, not all of them, some minerals to function properly. And these minerals are divided into two groups. One group is called major minerals, the other group is called trace minerals. So, major minerals are sodium, potassium, chloride, calcium, phosphorus, magnesium, and sulfur. And the trace minerals are iron, copper, zinc, selenium, iodine, chromium, fluoride, manganese, molybdenum. The major minerals, as the name suggests, all are important. Our body needs major minerals in a handsome amount on daily basis. Some of the major minerals are even needed in grams every single day, but some of them are needed in milligrams. But I will go to the definition of major minerals. Major minerals are those minerals which are needed uh, in 100 milligram per day. And trace minerals are those minerals which are needed in less quantity, some in milligrams and some in micrograms. So major minerals are required in amounts greater than 100 milligram a day. These are also called macrominerals. There are seven major minerals in our body, namely sodium, potassium, chloride, calcium, phosphorus, magnesium, and sulfur. So calcium is needed for our bone growth. Phosphorus is needed for DNA, RNA, ATP. You know ATP is adenosine triphosphate. ADP is adenosine diphosphate. Basically, the energy currency of our body all the time needs phosphorus because phosphorus is the major part of ATP and ADP, and it's also part of DNA cross linkages. So phosphorus is also very important for our diet. Then it's also part of our membranes. It's not just like that. Potassium is a major electrolyte of our blood. It is also involved in nutrient transport in our intestines. It is also involved in fluid and pH balance in our body. Nerve conduction is also important because sodium potassium ATPase is present all over the neurons. Sodium potassium ATPase is basically a sodium and potassium pump, which how can I explain in an easy way? Sodium potassium pump is basically a pump which is present on the membranes and surfaces of the neurons and other cells, which is involved in chemical signaling of the cells as well as nerve conduction, etc. So chemical signaling and nerve conduction involve the membrane potentials. So in order to create a gradient across the membranes, in order to create a difference between positive and negative charges, there is a pump which uses ATP, and that pump is sodium potassium ATPase. It uses ATP, and when ATP is broken down, then that ATP's energy is used by sodium potassium pump, which is present in all over the body, in the membranes of our all over the body, and it needs potassium to function. So sodium potassium ATP is the main pump on our membranes, which creates the gradients across the membranes, and potassium is integral part of that balance. It is present in avocados, potatoes, tomato, banana, acorn, squash, mango, coconut, buttermilk. Then we come to magnesium. Magnesium is also very important because there are 300 plus chemical reactions in our body which magnesium catalyzes. Magnesium helps those chemical reactions to occur. Then it also helps in muscle relaxation. Then it also takes part in protein and fat metabolism, heart contraction, brain and nerve function. It is present in vast quantities in almonds, brazil nuts, pine nuts, seeds, whole grains, herbs, spinach, broccoli. Then there comes sodium. As we already know, sodium is present in table salt. It is basically always needed in our body. It is the major electrolyte of our blood. Our blood contains basically plasma. Our plasma contains 0.9% sodium and chloride. It is involved in fluid balance, nutrient transport, nerve function, muscle contraction, and it is mostly present in cheese, processed foods as well, and seafood, as well as it is present in table salt. Chloride. So chloride is also involved along with sodium as sodium chloride as its part integral part of salts. The chloride is also involved in electrolyte balance with sodium stomach acid production. Yeah, there is one more function for chloride also helps in stomach acid production, fluid balance, immune function. Then there is sulfur is needed for our hair, for skin, for nail growth, joint health, protein structure, energy metabolism, and liver function, etc. And eggs are rich in sulfur. Sodium. So this is our first macro mineral, and this is the most important of all the macro minerals. Yeah, most of the macro minerals, as all of these macro minerals are important. But if you pick one most important macro minerals, then this is sodium. It is present in table salt, beef, eggs, poultry, milk, cheese, soya sauce, moderate amounts in breads and vegetables as well, large amounts in processed food. Yeah, processed foods use vast quantities of sodium along with chloride as well. So its functions are maintenance of fluid balance, transmission of nerve impulse. Then it also helps in acid base balance of our body and muscle contraction. Its deficiency causes nausea, exhaustion, muscle cramps, and toxicity causes hypertension and edema. The functions of sodium in infographic diagram are helps our cell uptake nutrients and water, helps our muscles contract, helps our nerves carry messages between the brain and the body, as I already told. Sodium potassium ATPase is the main pump present in the membranes of nerves as well as other signaling cells of our body. And without sodium and without potassium, that most important pump, the sodium potassium ATPase pump, does not function properly. Sodium along with chloride balances our body's fluids and regulates blood pressure as well. So sodium deficiency is also called hyponatremia. So basically in medicine, there are two terminologies used, one for excess and one for deficiency. The terminology used for excess is hyper. Anything in excess is hyper, and anything in deficient state in deficiency is hypo. So natremia is basically natrium is a Latin word for sodium. So hyponatremia means deficiency of sodium in plasma in blood. So hyponatremia is defined as serum sodium concentrations of less than 135 milli equivalent per liter as a result of an accumulation of total body water greater than the body's accumulation of electrolytes. Sodium plus potassium causes are excessive vomiting, because we excessively vomit, we are losing salts along with chloride as well. If we are using diuretics, they waste too much of salt from our body. If we are drinking too much water that our blood becomes diluted, then definitely there will be consequent dilutional hyponatremia in our body, which will not be just because of the total salt content getting low in our body, but due to water getting in excess in our blood. So basically, water increasing in quantity also causes salts to decrease in their concentration. This is 2 plus 2 is equal to 4. If anyone knows ABC of chemistry, they understand what I'm talking about. So excessive diarrhea, as we know, diarrhea and vomiting, they lose our salts on steroids, heart, kidney, and liver problems, dehydration, inadequate salt intake, and fluid shift from ICF to ECF. So hyponatremia symptoms are change in personality, confusion or short temper, fatigue, convulsion. Sometimes when there is severe hyponatremia, then there might be convulsions or seizures to the patient as well. Patient feels weak, their loss of consciousness or coma, low blood pressure, feeling nausea or vomiting. So basically, how to treat sodium? If a patient is alive and can take orally, if a patient is aroused and not unconscious and can take orally, then the patient should be given salt or salt water, table salt or salt water. But if the patient is unconscious or patient is in coma, then patient needs IV sodium and chloride replacement. with concentrated sodium chloride, that is 1.8% sodium chloride or 3% sodium chloride. Then our next most important mineral is, these are all macro minerals. Then our next most important macro mineral is potassium. Potassium is also an integral part of water fluid balance, electrolyte balance, acid base balance, because it is integral part of sodium potassium ATPase, and it helps in many functions. It takes part in many functions in our body. The food sources of potassium are oranges, bananas, dried fruits, vegetables, legumes, milk, cereals, and meat. The functions of potassium are contraction of muscles, maintenance of fluid balance, transmission of nerve impulses, regular heart rhythm, cell metabolism. The deficiency or toxicity of potassium is hypokalemia, muscle weakness. Deficiency is called hypokalemia. It causes muscle weakness, confusion, abnormal heartbeat, and its toxicity or hyperkalemia cause potentially life-threatening irregular heart rhythms. The functions of potassium in the human body in infographic diagram are fluid. It takes part in maintaining fluid balance. It also keep the heart healthy, blood pressure regulation, muscle function, bone health. Yeah, K2. Um, um, Potassium also takes part in maintaining bone health. It also helps our nerves function normally, and it also aids in digestion. Food sources of potassium, as we already discussed, it is rich in bananas, avocados, peas, fish such as salmon and pumpkins, etc. It is also present in vast quantities in oranges as well. So the causes of potassium deficiencies are: number one, dietary eating issues; number two, decreased kidney functions, because kidney conserves the potassium in our body, and if there is decreased kidney function, then definitely potassium deficiency is going to occur, as conservation of potassium in our body is done by kidneys. So potassium wasting starts in our body, and we are unable to conserve potassium. Then if there are any digestive health disorders in which there is less absorption or digestion of salts from our intestine, then if there is low intake of water, if there is some ongoing medications or age related health issues or anything like that, or if there is alcoholism, or yeah, alcoholism also causes potassium deficiency. And if there are age related health issues or some ongoing medications which also cause the losing of potassium from our urine, then we make it hypokalemia. And hypokalemia is basically low levels of potassium in our blood. And the symptoms of hypokalemia are Symptoms of hypokalemia are weakness and fatigue, muscle cramps and spasms. There are digestive problems. There are irregular heart rhythms, tingling and numbness, breathing difficulties, mood changes, high blood pressure, polyuria, yeah, increased urination. There is constipation as well. There are muscle pains, and there are hyporeflexia. Our muscles reflexes are decreased when we are losing potassium when we have lost enough potassium from our body. And the causes are, as we already know, there is vomiting and diarrhea. There are kidney disorders, some medications such as laxatives and diuretics. Then prolonged loss of fluid. As soon we lose sodium, we also start losing potassium as well. We also start losing potassium as well from our body. So, in order to treat the potassium deficiency, we need to take potassium chloride orally. And if we are unable to take potassium chloride orally, then there are IV fluids present all around the world called Ringer's lactate, which contains potassium. Ringer's lactate is a solution which contains potassium. There is another solution called Flavolite M, which also contains potassium. And in order to and if there is extremely low potassium in our body, we add potassium chloride ampules into IV fluids as well. And those potassium chloride ampules increase the potassium content of the fluid that we are giving to the patients, and then hypokalemia is treated. So the next important macro minerals is or major mineral is chloride. So chloride is also present in table salt, eggs, seafood, and milk, and its function is gastric acidity. As we know, our gastric acid is basically hypochlororic acid. So this acid is produced by our gastric parietal cells, and as it contains chlorine, it contains chloride ions. So if there is chloride deficiency in our body, the HCl production in our stomach decreases. So when HCl production in our stomach decreases, our digestion process in stomach starts to get disturbed. So when gastric acidity is decreased due to chloride deficiency, then there are problems with the digestion. And when there are problems with the digestion, we are unable to eat food properly or digest food properly. And there are more chances of infections in the gastrointestinal tract as well, because that hydrochloric acid, which is produced by stomach in our body, in our stomach, uh, basically kills bacteria that are coming with the food. So if there is decreased acid production in our stomach, we're also prone to gastrointestinal infection as well, as bacteria are not killed as they enter in the stomach. Chloride also regulates acid-base balance, maintains fluids and electrolytes, and formation of hydrochloric acid. Its deficiencies cause imbalance in gastric acidity and imbalance in food, pH, nausea, and functions. So functions of the chloride via infographic diagram are: it helps our cells take in and out nutrients and water, balances our body's fluids and regulates blood pressure, helps our muscles contract, helps our bodies digest foods, helps our nerves carry messages between the brain and the body, and helps the oxygenation of our bodies. So chloride deficiency causes our decreased intake. Either the patient is not taking chloride properly, if they are not taking salt from dietary sources properly, and if they are being given IV fluids, they are being given dextrose water only. They are not being given sodium chloride containing solutions. They are only given dextrose water. Then the problems with the chloride deficiency and the symptoms of chloride deficiency start to appear in the patient. If there is water intoxication, there is a relative deficiency. If there is increased loss such as diuresis, excessive vomiting, which causes hydrochloric acid loss from the stomach. If there is metabolic alkalosis, I will not go into the details of metabolic alkalosis. It is a medical terminology which means that there is um, increase in pH of our blood. That's enough for you people to understand. If there is increase in pH of our blood, then that condition is called metabolic alkalosis. Why are they using the term metabolic? It's basically not respiratory alkalosis, and there are two types of alkalosis called respiratory alkalosis or metabolic alkalosis. I will not go into details, because if I go into details, it will go beyond the scope of this lecture. If there are fistulas, so fistulas are abnormal communication between the two epithelial surfaces such as gut and skin. So if there is an abnormal opening between small intestine and our skin due to some surgery or any problem, due to some gunshot wound or some other problem, then a fistula is made, and it prematurely secretes intestinal fluids outside the body without proper digestion, without proper absorption. So that is fistula. So it causes increased wastage of salts from our body, as salts do not get the chance to get absorbed from the intestines, and salts keep getting wasted from uh, salts keep getting wasted from our body through these fistulas opening. Then there is ileostomy. So ileostomy is basically when the ileum, which is our small intestine, distal ileum, which is our small intestine. Our small intestine comprises of jejunum, duodenum, jejunum, and ileum. So ileum is the last part of our small intestine. If there is an ileostomy or jejunostomy, so basically the patient starts losing too much of the fluids, as there is no proper digestion, as the large gut is cut off, and patient starts losing fluids and salts excessively. If there is increased angisection or if there is excessive diarrhea, patient also starts losing chloride. So simple symptoms of low chloride levels are muscle weakness. Also, muscle weakness is noted in by sodium deficiency, and muscle weakness is also noted in potassium deficiency. Then there is fatigability, there is dehydration, there is difficulty breathing, there is changes in blood pressure, there is irritability, muscle twitching, arrhythmias, tingling in fingers and toes, confusion, and decreased consciousness. Patient may get comatose in severe chloride deficiencies as well. And if patient is conscious and can take orally, we need to give the patient table salt. And if patient is not conscious and cannot take orally, we need to give IV fluids to the patient, intravenous fluid to the patient contain sodium chloride containing sodium chloride. So another important macro mineral is calcium. So calcium is present in all of the dietary products such as milk, cheese, sardines, salmon, some dark green and leafy vegetables as well. Functions of the calcium include development of bones and teeth, transmission of nerve impulses. Yeah. Sodium also takes part in transmission of nerve impulses. Potassium also takes part in transmission of nerve impulses, and calcium also takes part in transmission of nerve impulses. It is also helpful in blood clotting because there are some reactions and some enzymes which are activated through calcium. So it helps in blood clotting cascade functioning normally. Then normal heart action needs calcium, normal muscle activity needs proper levels of calcium in our blood. Its deficiency causes osteoporosis. What is osteoporosis? I will discuss in the next slides. Then there is osteomalacia, then there is rickets. We did discuss what is osteomalacia. It is basically softening of the bones in adults. When adults have severe calcium deficiency, then their bones start to get softened, and that is called osteomalacia. And if children have calcium deficiencies, their long bones start to get bow. They are not straight. So the bowing of the legs or long bones starts to appear, and that is called rickets. Then there is tetany. Tetany is basically uncontrolled spasm of muscles of periphery, such as um, uh, calcium, such as hands and feet. Poor tooth and bone formation is also noted if there is calcium deficiency. And infographic diagram shows keeps the calcium is needed for whole bone health. It normalizes heart rhythm. It helps the nervous system. It keeps teeth healthy. It controls our weight. It relieves insomnia. It prevents osteoporosis, and it reduces the risk of colon cancer. Yeah, calcium reduces the risk of colon cancer, but there are the mechanisms are still unknown. The sources are already discussed. It is milk. It's present in milks, tofu, almonds, sesame seeds, cheese, sardines, etc., and broccoli as well. So the main cause of calcium deficiency is number one, main cause of calcium deficiency in all of the developing world is underdeveloped or developing world is vitamin D deficiency. Then there is also a link of calcium deficiency along with magnesium deficiency if there is poor diet, impaired parathyroid hormone function. Yeah, parathyroid hormone regulates calcium level in our blood. So parathyroid hormone function impairment also leads to calcium deficiency. Impaired calcium resorption by bones due to vitamin D deficiency. Underlying conditions such as intestinal malabsorption disorders. Yeah, intestines are unable to absorb any kind of salts and vitamins, etc. Then there are widespread deficiencies of vitamins and minerals noted in such people using certain medications such as PPI, steroids, and antihypertensives. Then there is lactose intolerance or milk allergy, and then there is menopause. If a woman is having menopause, then there is deficiency of estrogens in the body, and it results in calcium deficiency in females. Calcium deficiency symptoms in infographic diagram are brittle nails, frequent fractures, dry skin, tooth decay, irregular heartbeats, and frequent muscle spasm. Yeah, if a patient is having calcium deficiency, they start having frequent muscle spasms as well. Calcium deficiency continued. How does calcium deficiency affect bone health? It weakens the bones. It makes them more prone to fractures and breaks. Osteoporosis is basically long-term deficiency of calcium, which leads to a higher risk of osteoporosis, a condition characterized by brittle and fragile bones. It also impacts bone density, so low calcium levels can decrease bone density, causing them to become less dense and more porous. And when bones become more porous, then they are more prone to fractures. Slow growth. If patients are children, then the lack of calcium can hinder proper bone development and growth as well. Increased bone turnover, such as calcium deficiency, can elevate bone turnover rates, leading to breakdown of existing bone tissue without adequate replacement. So there is a diagram which shows osteoporosis. So normal bone is dense, where the bony matrix is dense, and its mesh is strong, the matrix is strong. But if there is an osteoporotic bone, its mesh is weak and the bone's density is decreased, which results in more fractures. So in old age, the cause of increased fractures is just this osteoporosis. So if our intake of calcium or milk diet or vitamin D, etc., is low, then we are prone to develop bone fractures, especially after 50 years of age, or especially after 60 years of age. Then there comes another macro mineral, and that is phosphorus. Phosphorus is present in milk, cheese, lean meat, poultry, fish, whole grain cereals, legumes, nuts. And functions of phosphorus are it helps in development of bone and teeth along with calcium. It maintains normal pH of the blood, constituent of all body cells. Yeah, it is present in all body cells as it is part of ATP, adenosine triphosphate, which is the major currency of our body, energy currency of our body. And its deficiency causes poor tooth and bone formation, weakness, anorexia, and general malaise. So, infographic diagram shows functions of phosphorus as forms and keeps strong bone and health, helps maintain our energy levels, forms of genetic material, DNA and RNA. Yeah, phosphorus is integral part of our DNA and RNA. So, if without phosphorus, our DNA and RNA cannot be replicated properly. So, cell division needs phosphorus all the time. It also helps from the membranes of our cells. Yeah, membranes contain phospholipids. So phosphorus is integral part of those phospholipids, which are integral part of the structure of our membranes. So phosphorus is needed for phospholipids, and phospholipids are forming blocks of the membranes of our cells. Phosphorus keeps the healthy function of our brain, keeps our brain and nervous system healthy, helps to maintain normal acid balance in our blood as well as in kidneys. It also helps oxygen delivery in the body. How does it help in oxygen delivery in the body? There are some substances, HMP shunt pathways, etc., which help in oxygen dissociation. And when oxygen dissociation occurs, oxygen is delivered to the tissues. So the phosphorus deficiency symptoms include weak or fragile bones and teeth, fatigue, weakness, loss of appetite, joint pain, stiffness, less energy, and susceptibility to infection. Phosphorus deficiency diseases include osteoporosis, stiff joints, and pain in the bones. Can also cause anxiety, irritability, sensitive skin, stress, tiredness, and weak teeth. Phosphorus deficiency it can be treated very easily. And here is the recommended daily allowance of phosphorus in different age groups. You people can read it later. I will not go into the details. Then there is another important macro mineral which is needed more than 100 milligram by our body on daily basis, and that is magnesium. Magnesium is present in green leafy vegetables, whole grains, avocados, nuts, milk, legumes, bananas, seafood, chocolate, cocoa. Its functions are nerve transmission and synthesis of ATP, activation of metabolic enzymes. Yeah, magnesium is needed for more than 300 reactions, and it activates many metabolic enzymes in the body. It also helps in muscle activity. It's also constituent of bones, muscles, and RBCs. And it's the deficiency problems related with magnesium are mental, emotional, and muscle disorders. So, health benefits of magnesium, we need to read it in detail. Magnesium is one of the most important minerals needed by the body, considering that it is involved in numerous biochemical reactions. These biochemical reactions involve a series of enzymatic reactions that are carried out through utilization of chemical compounds known as cofactors. So, these cofactors need magnesium for proper functioning. While magnesium is a well-known mineral, it is also an inorganic cofactor used in the synthesis of various vital compounds within the body related to metabolic and hormonal function. Specifically speaking, magnesium promotes calcium absorption and is used in maintaining normal nervous system function, thus promoting cognition as well as voluntary and involuntary muscle movement. In addition, magnesium aids in strengthening the immune system, maintaining heart health, and ensuring strong bones. Magnesium has also been shown to regulate blood sugar levels, treat hypertension, and prevent diabetes. So, causes of magnesium deficiency are depleted food sources. Yeah, if we are doing our organic farming, then the magnesium is rich in our soil, but modern day farming and food processing techniques have significantly depleted magnesium levels in our diet. Stress causes us to lose magnesium through our kidneys and urine. Certain drugs such as caffeine, alcohol, alcohol menace is everywhere. That is why chronic alcoholism destroys people because alcohol is mother of all drugs. And if you take alcohol for in excess and for longer periods of your life, it will ruin every single vitamin and mineral in your body. So alcoholism, proton pump inhibitors, which are antacid drugs, and even some antibiotics can deplete magnesium levels in our bodies. The symptoms are muscle spasms and tightness in muscles, tremors, menstrual cramps. Yeah, if a female is having menses and she's having severe cramps, she may be suffering from magnesium deficiency. Constipation, yeah, magnesium deficiency also causes frequent constipation as well, headaches, fatigue, heart palpitations, and psychological problems related with the magnesium deficiencies are insomnia or sleep deficiency, low mood, anxiety, and irritability. Then another important mineral is sulfur, and sulfur, calcium, and phosphorus are three most vital minerals plentifully present in the human body. Sulfur holds a significant role in vital processes in the system, like making proteins, regulating gene expression, building and repairing DNA, and supporting the normal metabolic processes. The mineral is also important for making and recycling glutathione, one of the body's key antioxidants that lessens inflammation and averts cell damage due to oxidative stress caused due to oxidative stress. Aside from this, sulfur also supports maintaining the integrity of connective tissues like skin, tendons, and ligaments. Sulfurs with the chemical symbol S is naturally occurring and can be found at number 16 in the periodic table of elements with a molecular weight of 32. It's more very important mineral for human beings. Keratin is important for healthy hair and nails. This sulfur-containing protein is also key structural component of the outer layer of human skin, which is called epidermis, keratinized epithelium. So keratin contains sulfur. It is a strong protein which protects our body. It is present in hair, it is present in nails, it is present in outer surfaces of our skin, and keratin contains sulfur. And then collagen is another structural protein, and collagen gives skin its strength and structure. Sulfur is also important in its synthesis. Amino acids produce proteins, which in turn produce enzymes critical for life. Sulfur is required to produce two of these amino acids. Insulin also needs sulfur for its production. Then there is joint inflammation if there is sulfur deficiency in the body, and antioxidant inhibits oxidation of other molecules, preventing cell damage. Sulfur is present in glutathione, one of the most important antioxidants. There is no recommended daily allowance for sulfur in our diet, but we do know what foods provide sulfur. Make sure your diet includes a variety from all the following: dairy, eggs, beef, poultry, seafood, onions, and garlic. Yeah, onions and garlic contain excess quantities of sulfur containing compounds, and when we are peeling onions, the tearing process that starts to appear in our eyes, and the pinching sensation that is felt in our eyes, and we start to have lacrimation as if we are crying, is just because of those sulfur substances present in onions and garlic. Then there is sulfur deficiency. So lack of sulfur causes arthritis, brittle nails, hair convulsions, depression, memory loss, gestational issues, slow moving, obesity, heart disease, Alzheimer's, and chronic fatigue, pain, inflammation related muscle and skeletal disorders as well. Then there are trace minerals. We cannot discuss every single trace mineral in this class because there are many trace minerals which are needed in micrograms or nanograms, and they are not as essential for life as well. But we will discuss important trace minerals and their deficiencies. So this section will shed light on the functions and deficiencies of important trace minerals. The trace minerals are those minerals which are required in the amounts in the diet in amounts lesser than 100 milligram a day. Sometimes also called microminerals. Out of these minerals, following four microminerals have common deficiencies which we will cover in today's class. So basically these are iron, iodine, zinc, and fluoride. So as we already know, iron is present in red blood cells. It takes a part in oxygen delivery. Then there is zinc, there is copper, there's chromium, there is selenium, manganese, there is iodine, there is molybdenum. So basically, out of these, iron, zinc, and iodine are the most important. Iron, zinc, and iodine are the most important, and their deficiencies are common as well. Although selenium, chromium, manganese, and molybdenum also take part in many reactions and many processes in our body, but their deficiencies are not as common as iron, zinc, and iodine because they are needed in very less quantities, sometimes in micrograms and sometimes in nanograms per day. So iron, it is the most important micro mineral. So yeah, I will go into details of iron. Iron is present in uh, red meat. It is present in chocolates, tomatoes, red fava beans, broccoli, nuts, etc. So food sources of iron are muscle, meat, poultry, shellfish, liver. Yeah, liver contains excess quantities of iron, whether it is mutton's liver, whether it is beef liver, whether it is liver of some fish, legumes, dried fruits, whole grain or enriched breads and cereals, dark, green, and leafy vegetables, mollusks. So all of these things are rich in iron. The functions of iron are it transports oxygen, carbon dioxide, it helps in hemoglobin formation, a component of cellular enzyme essential for energy production. Yeah, it is important component of those cellular enzymes which are essential for energy production. Its deficiency causes iron deficiency anemia. We will discuss iron deficiency anemia later on. So iron functions in the body through an image. It helps in oxygen transport. It is a primary component of hemoglobin in red blood cells. It also takes part in DNA synthesis and it is also integral part of cell growth and division as well. So iron deficiency, causing causes of iron deficiency include donating blood frequently, and frequently means less than 3 months apart. Yeah, if you have donated blood and if you are taking a good iron-rich diet, then still you need to wait at least 3 months before donating your blood again. And some guidelines also say 4 months that you cannot donate blood before 4 months window. Experiencing physical trauma or injury that results in blood loss. Yeah, it also causes iron deficiency anemia. Blood loss from nosebleeds, kidney or bladder disease or gastrointestinal disease, lack of iron in the diet, recent major surgery, pregnancy, breastfeeding, and menstruation. So all of these things related to women, such as pregnancy, breastfeeding, and menstruation, they also cause iron deficiency anemia. Common symptoms of iron deficiency include fatigue and tiredness. Yeah, you always feel yourself fatigued and tired. Then there is shortness of breath, there is pale skin, there are brittle nails, there is hair loss, craving non-food substances, increased sensitivity to cold, and frequent headaches. Then there is iron deficiency anemia. I will go into a little bit of details of iron deficiency anemia. Iron is very important in maintaining many body functions, including the production of hemoglobin, the molecule in our blood that carries oxygen. Iron is also necessary to maintain healthy cells, skin, hair, and nails. Iron from the food you eat is absorbed into the body by the cells that line the gastrointestinal tract. The body only absorbs a small fraction of the iron you ingest. Iron deficiency is very common, especially among women and in people who have a diet that is low in iron. So the most common hyperproliferative anemia is iron deficiency anemia, deficiency in iron that causes decreased hemoglobin production called precipitates iron deficiency anemia, and its pathology includes the most common cause of iron deficiency anemia is bleeding. The loss of blood signals the bone marrow to increase RBC production, causing depletion of the stored iron in the body. Red blood cell transport and removes carbon dioxide with the help of hemoglobin. So the causes of iron deficiency anemia we have already discussed. If we need to assess a patient with iron deficiency anemia, we need to take history. The patient will start telling about fatigue, ability, weakness, malaise, and pica. Pica means the urge to eat clay, the urge to eat paper, the urge to eat non-food substances. Basically, the patient eats clay, patient eats dirt. It's just because of a protective mechanism, as iron is rich in naturally in soil, as well as if you remember from your childhood, if you ever put uh, magnet in the soil, and if you keep rubbing the magnet in the soil for long, it will start uh, pulling towards itself. It will start pulling the iron toward itself, and within 5 to 10 minutes the magnet will be full of iron. That is why those people, especially children and women, especially women and children, they cannot resist to eat non-food substances just to complete the deficiency, just to fulfill the deficiency of iron, as iron is present in the clay. So there is a protective mechanism. These patients start eating clay as a protective mechanism, but the problem arises when the clay is full of worm eggs, and these patients get infested with worms. And when these worms start developing and multiplying in their bodies, the problem of the iron deficiency even worsens, and there is no benefit of eating clay. Instead, the patient starts to get pale even worsely. So the pallor in oral mucosa, conjunctiva, and palms increases, dry, brittle nails. There is lethargy, overexertion. Patient always feels overexerted, weird food cravings, inflamed tongue, reduced hemoglobin levels, nail changes and spoon nails, etc. So the treatment is iron supplements and dietary needs. As we have already told, there are many foods which are rich in iron. I have discussed that in our previous slide. Then there comes iodine. So iodine is also very important micro mineral, as it is integral part of thyroid hormone synthesis, as thyroid hormone is a very important hormone. So it makes iodine important, as iodine helps our body make thyroid. So there is iodized salt, seafood. If we are taking iodized salt, or if you are taking seafood, then you will not suffer from iodine deficiency. The functions of iodine are, there is only one function, and that is regulation of basal metabolic rate in our body. And the deficiency of iodine causes cretinism and makes edema or goiter. So the functions of iodine, iodine is needed to produce thyroid hormone, and thyroid hormones functions are discussed here. So iodine supports our thyroid's normal function. So iodine indirectly supports our healthy growth and development. It regulates our overall metabolism through thyroid hormone synthesis. It maintains our energy levels, and it regulates our body temperature through thyroid hormone synthesis. Then there is another micro mineral called zinc. And zinc is present in seafoods, oysters, liver, eggs, milk, wheat, bran, legumes, formation of collagen, wound healing, taste acuity. Essential. It is essential for growth and immune reaction. Its deficiency causes dwarfism, anemia, lack, loss of appetite, skin changes, impaired wound healing. Skin changes include dermatitis, and that dermatitis is called dermatitis enteropathica, and it's just because of zinc deficiency. There is impaired wound healing, decreased taste, and decreased acuity. Supports our healthy growth and development, supports our immune system. Zinc helps our DNA formation and regulates gene expression. It supports our reproduction along with selenium. Yeah, zinc also supports our reproduction. It helps our nerve carry messages between brain and the body. It helps our body build proteins as well. Zinc deficiency can occur if people have medical problems that interfere zinc absorption from their food, or if they don't have enough zinc in their diet. Zinc deficiency can happen in people who have problems absorbing nutrients from food, for example, older people and those who have gastrointestinal gut diseases. Vegetarian and vegans and people on other long-term restricted diets may be at higher risk of zinc deficiency. Zinc is only found in low amounts in breast milk, so babies who are exclusively breastfeed longer than 6 months may also experience zinc deficiency. Sometimes newborn babies experience zinc deficiency if they are premature or very sick as well. 10 symptoms of zinc deficiency include weight loss, mood disturbances, loss of appetite, loss of hair. Alopecia is loss of hair. Hypogonadism. So basically, your testes are not fully developed if you are zinc deficient in your adolescent life. Elevated levels of blood ammonia. Then there is uh, vague type of dermatitis. There are skin lesions which are just because of zinc deficiency. So if you start supplementing the patient with the zinc, there's dermatitis gets settled, then there is decreased taste acuity, night blindness, slowed wound healing. Then there is fluoride. We will just shortly discuss fluoride. Then we will wind up our class and we will go to our question and answer session. I am ready to take on all the questions of you people, as I could not take the question related to vitamins in our previous class as well. So fluoridated water, seafood increases resistance to tooth decay. It is present in fluoridated water and seafood, and its function are increases resistance to decay and its component of bones and teeth. So deficiency of fluoride causes tooth decay, possibly osteoporosis as well, and its toxicity. Yeah, fluoride is needed in minor quantities. If you take fluoride in excess quantities, that is also toxic for your teeth as well. And there is a condition called fluorosis or fluoridosis, which is due to excess fluoride in our teeth as well. So discoloration of teeth or mottling starts to appear if there is excess fluoride being given to the patient. Fluoride strengthens teeth and reduces your risk of cavities. Basically, it remineralizes your tooth enamel. It reverses early tooth decay. It slows down the process of demineralization. It prevents the growth of cavity causing bacteria. Fluoride deficiency can lead to tooth decay and possibly osteoporosis. Consuming enough fluoride can make tooth decay less likely and may strengthen bones. The addition of fluoride, fluoridation, this process is called fluoridation, just like addition of chlorine is called chlorination. So addition of fluoride called fluoridation to drinking water that is low in fluoride, or the use of fluoride supplements significantly reduces the risk of tooth decay in areas where drinking water is not fluoridated. Children may be given fluoride by mouth. Fluoride in human health and nutrition through diagram. So basically, it is present, it is needed in small amounts. It prevents dental caries. Excessive intakes can result in development of dental or skeletal fluorosis. The adequate intake is set at 0.05 mg per day per kg body weight. Main sources of water, tea, food, especially fish, and there are some fluoridated toothpastes as well. And those minerals which could not be covered in detail are chromium, selenium, and manganese. So basically, manganese is very less important, but chromium and selenium are important minerals. So we will discuss from this table. There is all of the minerals are most of the minerals are discussed in this table, but from the things that we need to discuss from this table are chromium and selenium. So chromium helps our insulin move glucose. that is sugar from blood into cells. Its deficiency affects abnormal glucose metabolism, and its toxicity causes muscle degeneration. It is present in meat, whole grains, and vegetable oils, just like that selenium. Selenium is an antioxidant and it works in synergy with vitamin E. Vitamin E is also an antioxidant and it helps in our reproduction. So, if we take selenium and vitamin E, our reproductive life becomes better. Keshan disease is deficiency. Its deficiency results in Keshan disease, muscle pain, degeneration, cataracts, low sperm count, fragile red blood cells, and heart damage, nail and hair brittleness and loss, nerve, muscle, liver damage, nausea, seafoods, organ meats, other meats, grains, vegetables, depending on soil contact, also contain selenium. So basically, selenium is an antioxidant and it works in synergy with vitamin E and it helps in reproduction of our it helps in keeping our reproductive system healthy, and chromium is needed for the better functioning of insulin and glucose metabolism. Have a nice day. Thank you. So, if you can ask any questions, you are free to go.
Excellent. That is mineral deficiencies and how they affect the health. So there's a lot of information here. So this class is being recorded and you can go back and watch this again. And this is great material for an assignment so that so that you can think about which minerals are really important in your life or your family's life. Okay, we got some questions coming in. I see
I'm
Columbus.
ready to take all the questions. Yeah.
Oh, wait, Asfa.